Will my insurance pay for a brain tumor PET scan? If you're wondering whether your insurance will cover a PET scan for a brain tumor, you're not alone. Many people ask this because PET scans can be an important part of diagnosing and monitoring brain cancer. The answer depends on several factors, including your insurance plan, the medical necessity of the scan, and your healthcare provider's recommendations. Most major health insurance plans, including Medicare, generally cover PET scans for brain tumors when a doctor orders the test and clearly states it is medically necessary. Medical necessity means the scan is essential for diagnosing, staging, or tracking the progress of a brain tumor. Your doctor must provide documentation showing why the scan is needed based on your specific condition. For those on Medicare, coverage is quite straightforward. Medicare Part A covers PET scans if they are done during a hospital stay or nursing facility stay, after you meet the deductible. Medicare Part B covers outpatient PET scans when a doctor orders them and they are medically necessary. In this case, you are usually responsible for a deductible and about 20% of the cost as co-insurance. Medicare Advantage plans, which are private plans that work with Medicare, often cover PET scans if Medicare covers them, but out-of-pocket costs can vary depending on your plan. Private insurance plans also typically cover PET scans for brain tumors, but they often requiring prior authorization. This means your healthcare provider must submit a request explaining why the scan is necessary. Insurers may deny coverage if they believe other imaging tests like CORT or MRI are enough, or if they consider the PET scan too costly. However, PET scans offer unique metabolic information that can detect tumor activity earlier than other imaging methods, which can be very helpful in treatment planning. Even if your insurance approves the scan, you may still have to pay some costs. These could include deductibles, co-payments, or co-insurance, which depend on your specific insurance plan. Because PET scans can be expensive, it's a good idea to check with your insurance provider beforehand to understand what costs you might face. If your insurance denies coverage, don't give up. You can work with your healthcare provider to appeal the decision. Providing detailed medical documentation and justification can sometimes help overturn denials. In some cases, seeking assistance from patient advocacy groups or legal resources may be beneficial. In summary, if your doctor recommends a PET scan for a brain tumor, your insurance will likely cover it if it's deemed medically necessary. Medicare generally covers these scans for brain cancer diagnosis and monitoring, and most private insurers do too, though prior approval and cost-sharing are common. Always verify your coverage details before scheduling the scan and discuss any concerns with your healthcare provider. Remember, each case is unique, so personalized advice from your medical team is always the best course of action.